Have you ever felt like the world is losing a bit of its shine? That colors look faded, or that driving at night has become an impossible mission because of glare. You might think it's just a part of getting older, but what if your eyes were sending you a signal? A signal of something called cataracts. Today, we're going to reveal the 5 warning signs that can appear years, even decades, before a diagnosis. And most importantly, we'll tell you what you can do to slow their progression. Stay until the end, because we'll also expose the one sign nobody connects with cataracts and the critical mistake most people make that speeds up their appearance. First, let's understand the enemy. What exactly are cataracts, and why do experts say they're almost inevitable if we live long enough? Imagine you have a lens inside your eye, like the one in a camera, that is perfectly clear. It's called the crystalline lens, and its job is to focus light so you can see the world clearly. Now, imagine that over the years, that lens starts to fog up. It becomes cloudy yellowish. That, in essence, is a cataract. At first, it's like looking through a slightly dirty window. You barely notice it. But over time, that fog gets denser until seeing clearly becomes a challenge. And here's a fact that surprises many: this isn't a rare condition. Vision health experts, like Dr. Alex Rogers, point out that by age 65, nearly half the population already shows some degree of lens clouding, even if they don't realize it. And by 75, that number skyrockets to almost 90%. The question isn't if they will appear, but when and at what speed. Because although aging is the main driver, there are factors that put the pedal to the metal. Factors we can control. And that's the good news. There is a safe and effective solution, but before we get to that, we need to know the clues our body gives us. Let's get into the 5 early signs that most people ignore for years. They mistake them for a strain or just normal aging. Don't make that mistake. Sign number 1. Progressive blurry vision. We're not talking about the kind of blurriness that goes away when you clean your glasses. We're talking about a loss of sharpness so slow and gradual that your brain gets used to it. Traffic signs, store signs, the subtitles on TV, everything starts to lose its definition, as if a thin layer of fog is covering it all. A word of caution: if your vision loss is sudden or painful, it's not cataracts. In that case, see a doctor immediately. But if it's progressive, it's the first major red flag. Sign number 2. The world at night becomes your enemy. Do oncoming headlights dazzle you to the point of being dangerous? Do streetlights no longer just illuminate, but create annoying halos around them? If you stopped driving at night because you feel unsafe, pay attention. According to experts like Dr. Rogers, this happens because the cloudy lens scatters light instead of focusing it properly. It's like having micro scratches on a lens. Light bounces in all directions, creating that blinding glare. It's a key sign and a real risk to your safety. Sign number 3. The world loses its color. This is the most subtle and poetic sign. Colors start to look washed out, yellowish, like in an old photograph. The blue of the sky, the green of the grass, everything loses its intensity. The change is so gradual that most people don't notice it until after the solution. There are patients who, after treatment, get emotional rediscovering how vibrant the world truly is. As the lens yellows, it acts like a filter, blocking blue and violet tones. It's like wearing sunglasses all the time without even knowing it. Sign number 4. Double vision. But only in one eye. This sign is less common but very specific. If you cover one eye and, with the open eye, see a double or ghost image, you could be looking at an early cataract. Specialists call this monocular diplopia. It happens because irregularities on the surface of the lens split the light, creating multiple images. This is different from seeing double with both eyes open, which could indicate a serious neurological issue. But if the problem is in just one eye, a cataract is a prime suspect. Sign number 5. Your glasses don't seem to work anymore. Do you feel like you have to change your glasses prescription every year? That your vision is constantly changing? This is very revealing. A developing cataract can change the way the lens focuses light, causing frequent shifts in your nearsightedness or astigmatism. There's even a curious phenomenon: some older adults who needed glasses to read suddenly find they can do so without them. Sounds like a miracle, right? It's not. It's a sign that the cataract is progressing and changing the eye's focusing power. A false improvement that hides a warning. If you recognize one or more of these signs, don't just write it off as normal. It's time to consult a professional. But now, the key question is, what can we do to stop this from getting worse? We can't stop time, but we can take our foot off the cataract accelerator. There are factors we can't control, like age or genetics, but others are completely in our hands. Enemy number one, and the easiest to fight, is the sun. Ultraviolet radiation damages the proteins in the lens cumulatively. Every day in the sun without protection is a small assault on your eyes. Sailors, farmers, people who work outdoors have much higher rates of cataracts. The solution is simple: sunglasses. But be careful. Not just any pair will do. They must be certified for 100% UV or UV 400 protection. Dark glasses without a UV filter are even worse because they dilate your pupils, letting in more harmful radiation. The second factor is tobacco. Smoking, according to multiple studies, doubles the risk of developing cataracts. The toxins from the smoke travel through your bloodstream to your eyes, accelerating the oxidation of the lens. The good news is that when you quit smoking, the risk starts to decrease. Third, poorly controlled diabetes. Excess sugar in the blood causes chemical changes in the lens that speed up its clouding. People with diabetes have up to 5 times the risk. Keeping your glucose stable is crucial for protecting your vision. Other factors include the long-term use of steroids, eye injuries, and excessive alcohol consumption. Prevention is in your hands. Protect your eyes, take care of your overall health, and, of course, feed your vision. Can food slow down cataracts? The science says yes. There are no miracle foods that will cure them, but there are nutrients that act as a protective shield. The lens is under constant oxidative attack. The antioxidants in food neutralize that damage. Experts in ocular nutrition highlight 3 heroes: vitamin C, found in citrus fruits, red peppers, and broccoli. The lens has one of the highest concentrations of vitamin C in the entire body. It needs it for defense. Lutein and zeaxanthin. These are yellow pigments found in dark leafy greens like spinach and kale, and also in egg yolks. They act like internal sunglasses, filtering out harmful blue light. Vitamin E found in nuts, seeds, and olive oil. It protects the delicate cell membranes of the lens. The key isn't one isolated nutrient, but a pattern. The Mediterranean diet, rich in all these elements, is consistently associated with a lower risk of cataracts. Your plate can be your best vision insurance policy. Now, let's bust the most dangerous myths out there. Myth number 1. There are drops that can dissolve cataracts. False. Absolutely false. There is no eye drop or magic product that can reverse a cataract once it has formed. It's a physical change in the proteins, like a cooked egg that can't go back to being liquid. The only effective solution is surgery. Myth number 2. Reading a lot or using screens causes cataracts. False. Screen use can cause eye strain or dry eye, but it doesn't damage the lens. Cataracts come from aging and the risk factors we've already discussed. Myth number 3. You have to wait for the cataract to be ripe to operate. This was true decades ago. Today, with modern technology, it's the opposite. It's recommended to have surgery as soon as the cataract begins to affect your quality of life. It makes no sense to spend years with poor vision unnecessarily. So, when is the ideal time for surgery? The answer is personal. Dr. Alex Rogers and other specialists agree that the main criterion is one thing: when your quality of life is affected. If you can no longer drive safely at night, if reading, sewing, or enjoying your hobbies has become a struggle, if your blurry vision increases your risk of falls, a very real danger for older adults. When the cataract prevents you from living your life to the fullest, the time has come. Cataract surgery is one of the safest and most successful procedures in modern medicine. In about 15 minutes, not only is the cloudy lens removed, but a new intraocular lens is implanted that can correct nearsightedness, astigmatism, and even the need for reading glasses. It's a chance to regain lost vision and often see better than you have in years. Let's summarize the 3 key takeaways. First, cataracts are a part of aging, but their progression can be slowed. Protect your eyes from the sun, don't smoke, manage your health, and eat a rainbow of fruits and vegetables. Second, learn to recognize the early signs. Gradual blurry vision, nighttime glare, and faded colors. Don't ignore them. Third, forget the myths. There are no magic drops. Surgery is safe, and the right time to act is when your vision limits your life. Seeing clearly isn't a luxury. It's essential to enjoying the world in all its glory. If you found this journey inside our eyes helpful, please hit like and share it with someone it might help. And let us know in the comments, have you noticed any of these signs? Take care of your vision, and we'll see you in the next video.